There's nurses standing around, other doctors standing around, and he's going to do the procedure. So he introduces me to everybody, and they said, "This is Herb Schlomann, born and raised on a farm, and he does ballroom dancing." So the nurses all go, "Ballroom dancing?" In 2019, my heart was beating slow, beating fast, and pounding at times. Pounding that it would wake me up at night. I went to my heart doctor, and I have a problem with my heart, with it's a erratic heartbeat. And he said I also have a cavity in my heart, in the one cavity, which blood could go into and congeal. I could get a particle going up to my brain and have a stroke.
Herbert has a history of something called atrial fibrillation, which is an irregular heart rhythm that can be fast at times. And with this, it can actually lead to the formation of blood clots. And these clots can increase your risk of developing strokes. Majority of patients are recommended to take a blood thinner. Unfortunately, not everybody can take a blood thinner. In Herb's situation, he actually suffered a life-threatening stomach bleed in 2018. And since that time, he wasn't able to take any blood thinners, so his risk of having a stroke was even higher. But we had to mitigate that with his risk of life-threatening bleeding. Thankfully, there are options for patients like Herb, such as the Watchman FLX device. The Watchman FLX device basically acts like a filter. It's a small umbrella-shaped device that is implanted using a catheter, and it's a minimally invasive procedure. I tell people it's not an open heart surgery, which I think reassures them.
The procedure was done at 7:30 in the morning, and it didn't take that much time. It was very quick and absolutely no pain, which surprised me. Rather than medicines, where you got to keep changing them, and there's side effects on all of them, you take this procedure, and you never do anything. There's no blood thinners, there's no anything. You just have that installed, and that's the end of it. It's like you're recovered as soon as that Watchman is put in your heart.
So about 45 days to 3 months after the procedure, we'll do what's called a transesophageal echocardiogram, or TEE. And basically, it's a special ultrasound of the heart where the camera goes down the patient's throat under sedation. We're really looking inside the heart to make sure that the heart tissue has sealed nicely around the device, that there's no gaps or leaks. And if that looks good, that's usually when we can start weaning patients off of their blood thinners.
So I said, they really keep checking you out thoroughly to make sure that everything is working correctly.
I think that the greatest benefit to having a Watchman device implanted is freedom from blood thinners, freedom from risk of bleeding or continued bleeding, and also still having that stroke protection.
Being a farmer's son, I certainly like to garden outside in my backyard. I exercise, and my wife and I dance. But we rumba, we waltz, we cha-cha, a tango, all kinds of dances.
As a nurse, the most rewarding part of my job is seeing patients get better. And in this position, it's been fantastic because I get to see people keep doing what they love doing.
Valley Hospital is a fantastic hospital. The people, the way they treat you. Here, the crew they had in that Watchman area is unbelievable. You're only going to have nice things to say. Made me feel safe.